I'm the Halton Regional Chair and also Chair of the Halton Board of Health. With me today is Dr. Hamida Maghani, who's the Medical Officer of Health for the region. We also have Elizabeth Richardson, who is the Medical Officer of Health at the City of Hamilton, and also Dr. Barry Lum, the Physician and Chief Medical Executive. And I will call on our Medical Officer of Health, Hamida.
Good afternoon. Late last night, we received confirmation of the first confirmed positive case of COVID-19 in Halton Region. The individual is a 32-year-old female resident of Burlington and a frontline healthcare worker at Hamilton Health Sciences. This is a travel-related case. She returned from a trip to Hawaii on Saturday and became symptomatic on Monday. She followed all precautions and was tested at Hamilton Health Sciences Juravinski Hospital on Monday, March 9th. The hospital took all necessary precautions and followed standard operating procedures, including testing and assessment. She's now at home isolating and following public health direction. Halton Region Public Health, Hamilton Public Health, and Hamilton Health Sciences are working closely to identify all known contacts who may have been potentially exposed to the virus and to assess if there is a potential health risk. Understandably, this may be concerning to Halton residents. I want to reassure everyone that the risk in our community remains low at this time. Residents are encouraged to visit our website, halton.ca/coronavirus, to get the latest information about symptoms and when to contact Halton Region Public Health. We encourage residents to continue good prevention practices such as washing your hands regularly, using hand sanitizer, disinfecting surfaces, and staying home when ill. These are still the best way to protect yourself and others. I will now ask Dr. Barry Lum to speak to you.
Thank you. I would like to start by pointing out that Hamilton Health Sciences has been very aware of the COVID issue literally for weeks, and we have been beginning our planning around response should we have a positive case, and have put together a number of processes and planning around that. So when this incident came up yesterday evening and we became aware of the positive case amongst one of our healthcare workers, we really were able to respond very quickly, and beginning last night at around 10 p.m., a whole series of processes have been undertaken to protect our patients, our staff, and our physicians in the circumstance. This individual was working in our cancer center on Monday afternoon. She became symptomatic as the afternoon evolved and was highly responsible in her response. She called an infectious disease specialist. She arranged to be tested and then immediately left the building and self-isolated at home. Subsequent to our receiving the positive report, we have now been in touch with all of the other individuals who are working in that clinic, as well as all of the patients that that individual saw that day. As of right now, she is at home and self-isolating, and we feel that we have our situation in the JCC, in the Cancer Center, well under control. We are open for business, and we are continuing to take care of patients. Obviously, we will be in touch with our staff and our patients and providing support in combination with our colleagues at Public Health.
Thanks to Barry and to Hamida. So I'm Elizabeth Richardson. I'm the medical officer for Hamilton. We have been working, as I think many of you know, with our colleagues across the health sector to be prepared for COVID and to respond to any issues. This includes, of course, Hamilton Health Sciences. We are very pleased with the precautions that were taken yesterday by the individual who is involved. They were very responsible in their actions, presenting quickly for assessment as soon as they became symptomatic, and all precautions were taken from that point forward. We are working with Hamilton Health Sciences in identifying anybody who may have been a contact with this individual during the time that they became ill. We have done 3 levels of contacts at this point, and our investigation is still ongoing. We're working this through, but at this point, there are 3 levels of contacts. We have identified those who worked most closely with her and her patients. Those are the individuals who we think would be a higher risk, and so we have asked them to self-isolate and remain at home. We have identified a 2nd level of contacts who would not be as at high risk, but we are treating similarly out of an abundance of precaution. And those are the other individuals who worked in the area with them that day. And so we are asking them as well to self-isolate and stay at home. And then we have identified a 3rd group of contacts who are the patients who those clinicians saw that afternoon, asking them as well to be notified and working this through with Hamilton Health Sciences. And they're being notified and asked to self-monitor going forward, being made aware of the situation and asked to self-monitor. So we really have gone a full extent. We're very satisfied that we're getting a good degree in terms of contacts that may be there. And part of the reason for that is the setting that we're talking about, this being a cancer center. And so people who might be at higher risk in terms of having a more severe illness. And so we are taking a very cautious approach as we move forward. I do again want to reassure people in Hamilton, as Dr. Magani has said about Halton, that the risk here in Halton remains low. This was a travel-related case. We continue to emphasize for people as they are going about their daily business to think about respiratory infections and to protect yourself against them. This is our advice that we'd give everybody every day. Stay home if you're ill. Wash your hands often. If you're working with somebody or near somebody who's ill, make sure to keep a safe distance and to vaccinate yourself and keep yourself healthy otherwise to be in as good shape as you can. So that's it from me. I'm going to hand it back to Dr. Magani in terms of questions.
So we'd like to invite any questions.
How many patients did this doctor treat, and how many staff did she come into contact with?
So she treated 14 patients on Monday afternoon. All of those patients will be contacted together with any family members who attended in the room with the patient. There were 5 staff members actively working in the clinic. They have all, as you heard, been notified and are self-isolating at home. There were 3 other physicians also involved in the clinic, 2 of whom are self-isolating at home today. 1 physician is actually traveling, and we're actively trying to reach her as quickly as we can.
And this physician is an oncologist?
Correct.
Samantha from the CDC. So that's 7 who are self-isolating at home.
Correct.
Dr. Richardson referenced the fact that there were cancer patients, obviously people whose immune systems are compromised. Can you speak a little bit more about if you have any additional worries because of that population?
So you're absolutely right. Of course, they're cancer patients, and we all know that they're a particularly vulnerable group of patients. And I think what it speaks to is our vigilance now, should any of these individuals develop symptoms, that we have an extremely low threshold to bring them in and investigate them. These individuals are at risk of other kinds of infections, so it is very difficult based on that to be sure. So we will have a very low threshold.
When you say that you took the necessary precautions, can you actually outline what those precautions are? Because we keep hearing from, health officials that we're taking precautions. What exactly are they?
So on a day-to-day basis, we would expect, and we obviously encourage all of our staff to follow safe day-to-day infection prevention precautions, which means frequent hand washing, appropriate treatment of rooms after the workday to make sure that they're fully disinfected, and a low threshold to report symptoms should they feel that they're unwell.
Should those who shared the airplane from Florida, from Hawaii, be concerned for their health?
Yeah, I'm going to let Elizabeth answer that perhaps.
So as I mentioned before, our case was not symptomatic on her flight, on her journey home. So we should not be worried about that situation.
So is it only able to be transferred to someone if it's symptomatic?
At this time, the risk is associated with symptoms.
What were her specific symptoms the day that she was treating patients? Can you describe the specific symptoms that made her think, oh no, I better get tested?
She had some mild respiratory symptoms and acted, as Dr. Lum and Dr. Richardson have said, very quickly to be identified and, was seen in the emergency department. And as we mentioned, in terms of proper procedures, those procedures were also taken in the emergency department. So once she had been identified, she was then seen in an isolated room, and appropriate PPE was worn by staff who were seeing her.
Did those symptoms develop throughout her shift, or did she show up to work already exhibiting those symptoms and treat people?
So this is very early in our investigation. Because we only received this information about this case late last night, the investigation is still underway. We will be making those determinations, but these types of investigations do take some time, so we're looking into that.
Is there any thought to have folks that are working in the healthcare industry, especially people who might have compromised immune systems, who are traveling, come back and have some time before they come back to work to see whether they have any symptoms? Or is that just not reasonable?
So as has been mentioned before, the Public Health Agency of Canada is asking all travelers who are returning from outside of Canada to self-monitor for symptoms of COVID-19, and should they experience any symptoms, to isolate themselves immediately and to call upon local public health for further direction.
Self-monitor doesn't mean don't come to work when you work in a hospital or healthcare environment where you could be compromising other people's health, right?
At this point in time, we're not asking people to self-isolate unless they are coming from certain areas of the world.
Has anything changed as a result of this case where doctors still going to be traveling and coming back and working with cancer?
Yeah, again, this is evolving very quickly, and so our current recommendation is for any healthcare worker, physicians included, that if they travel to a high-risk area, that they should self-report and actively monitor their symptoms. If that further evolves as this situation evolves, I think we have to be prepared to respond to that. We're very aware that we could be in a situation where many individuals are suddenly having to self-isolate, and how we will provide care needs to be very carefully sorted through. So at this point, we would not say that they had to do that, but I would not say that that might not change.
Dr. Lum, isn't your hospital system asking doctors not to travel at all right now?
We are asking people to think twice before they travel internationally. We can't, at this point, mandate people to not travel, but we are certainly actively encouraging people to think about the risks.
Can I ask you the living situations of some of the patients? Are any of them living in, for example, long-term care homes? Is that a concern that they've gone back to the nursing home?
Yeah, I can't answer that, I'm afraid. I don't know the details around the individual patients.
In terms of frontline staff members, doctors, nurses, personal support workers, if they're exhibiting symptoms before they come to work, whether it be the common colds, is there some sort of way to screen people before they come to work to avoid these types of situations? I mean, she knew that she traveled to Hawaii. She came to work and she treated patients and then had her symptoms looked at. I mean, it's.
So
I would ask why she even went to work if she was feeling under the weather.
So I think we need to be actually quite proud of this physician. She did not come from a high-risk area. She was highly vigilant when she got to work, and as she became unwell as the day evolved, she immediately undertook exactly the right thing. She contacted an infectious disease colleague. She arranged to be tested in an area that was properly isolated with proper PPE. So I don't think there's any sense that this individual did anything other than the right thing. In terms of others, if they haven't traveled at this point in time, I think people need to be vigilant about their symptoms. The good news is that when we will be testing for flu of any kind in the Hamilton area, COVID will be part of that routine testing from now on. So we're actually in an exceptionally good position to test for this virus, and very rapidly, within 6 to 8 hours, we can get a result.
Is there any information on how long after you contract coronavirus you'll be exhibiting those symptoms? She came back on Saturday and she wasn't feeling ill.
Do you guys want to take that, or you want me to take it? I'll let you guys take it.
So when we talk about what you're referring to, which is our incubation period, the range is between 2 and on the outskirt about 12 to 14 days, which is why we ask people who need to be self-isolating to self-isolate for 14 days, but it can be as short as 2 days. Yes.
Thank you, that's important. So we have a policy that every clinic is thoroughly cleaned with an appropriate disinfectant every night. So on Monday evening, that clinic would have been cleaned. On Tuesday evening, that clinic would have been cleaned. And then out of an abundance of caution, we actually had a very aggressive terminal cleaning carried out in the night last night. So that area has in fact been thoroughly disinfected 3 times.
Can I ask you, sorry, when will there be a need for additional testing locations like we've heard is happening in the GTA and people screening locations?
Okay, I'm going to let this guy.
Or maybe Dr. Richardson, you can speak to that.
Sure thing, Tevya. In terms of the testing piece, that's a piece that's being looked at across the province. And so if I separate that into 2 questions, which is, do we have testing capacity and where is that happening? And are we setting up special sites where people might go who are feeling ill? So as you heard from Dr. Lum, there has been a conscious effort across the province to increase the number of sites that are capable of doing this kind of testing and to increase the number of tests that are being done. So, for example, there are a number of hospitals in Ontario that are being asked to do additional testing just so we can look for that virus and make sure that it's not spreading here in Ontario. So we've not seen that community spread until I believe you've heard about a press release that went out last night and for today. That's the first sign, but we've already been testing for a week or so to see about that spread. In addition, in terms of assessment centers, so places where people can go to be assessed if they're symptomatic, those sorts of things are being talked about in Hamilton and elsewhere in the province, and the approach in terms of when might that actually happen is actively under consideration at the provincial level and the local level.
Dr. Richardson, what's your reaction to the World Health Organization declaring this a pandemic?
So it's we're very interested to hear that from the WHO today. This is something that has been an active discussion at the WHO level. And of course, I'm not privy to the particular discussions they've had. We're just trying to understand that here locally because we just actually got news of that while we were sitting, waiting to come into the room here today. And so we'll be following to look at what further thinking they have in terms of making this declaration and what further steps they're advising.
Can someone please explain what happened with the notification? Can you just sort of explain? You heard late last night, it was confirmed. What was then, when did you, for example, hear Dr. Richardson?
So we heard late yesterday evening, and at first it was thought that it was actually a Hamilton case. And so with our staff beginning to undertake investigation, it became evident that this was actually a Halton case. And so it became evident that we needed to all work together on the issues and do the investigation. And we've been doing that since late last night, as you heard from Dr. Lum.
Do you know why it took until late morning this morning for staff at HHS and for the public in Halton to be notified about this case?
So when we undertake these investigations, we need to get our facts. We need to gather that information and make sure we have that correct information so we can go out. We try our darndest to get out the very first minute that we can get there. I think you've seen very early on from HHS, they are being very responsive with their staff. They want to make sure that people who are most directly affected hear first and can take those precautions and then reach out to their staff and us reach out to the public to make sure that they have the information they have.
You mentioned, I believe you said it was another physician who worked in the clinic with this oncologist who's traveling. Do you know where that person is traveling to? And have you been texting them or how have you been trying to reach them?
Yeah, truthfully, we're still trying to sort out this. The individual happened to leave the country earlier today, so I'm assuming that when they land and they turn on their phone, that they're going to get a message from us, and then we'll be speaking to them directly and having a conversation about next steps. And obviously, that's going to be a bit complicated depending on where they are and what their circumstances are.
And that is a doctor? Sorry.
Pardon me?
That is a doctor?
Yes, it's another oncologist.
I'm sorry, do we know where they are?
No, not yet.
Can I clarify some of the numbers? You said there were 14 patients that this woman treated on Monday, and there were 5 staff members that she worked with, but only 7 people are self-isolating right now?
So maybe I'm getting the arithmetic incorrect. I believe I said there were 5 staff, non-MD staff, in the clinic, all of whom have been notified. 2 physicians in the clinic have been notified and are also self-isolating. I did neglect to say that there is 1 learner in the clinic who has also been identified and is self-isolating, and then the last individual is the one who is traveling.
Sorry, you mean like an intern?
A senior resident, senior oncology resident.
And for those 14 patients, there's no word on whether they've contracted anything or they feel like.
Well, it's exceptionally early in this time to say that they have contracted anything, but I think it's important to know that they are all going to be contacted, as well as any individuals who have attended with them. Obviously, patients bring their loved ones with them to these kinds of visits, and we will be contacting them as well.
Was there any contact at McMaster? If this was a senior oncology resident, did that resident then
No.
go back?
That resident was identified and is now self-isolating and would have no reason to be at McMaster. Their work is based at the JCC.
The person who's traveling, is that male or female?
Female, I believe, but I can't give you any other details at this point.
Clarify, so it's 14 potential patients that may have come into contact with this doctor.
Correct. It is 14 patients who came.
And those 14 patients haven't been contacted yet, or they have?
We are in the process of contacting all of those patients and their family members.
Is that by phone, email?
Yeah, I think maybe Elizabeth can tell me where we're at in combination with public health, but yes, they will be all contacted as quickly as we possibly can, and likely most, if not all, have been contacted by now.
HHS has said on its update online that the risk to those, working or receiving care or visiting is very low. But how do you know that if this doctor, if these are people with compromised immune systems, like how can you say the risk to them is very low if they were treated by this doctor?
I think we have to put this in a bit of context. This was very early in this physician's symptom complex. They did not have respiratory symptoms such as cough and sneeze. They did not have a fever. So we can't say that they're not at risk, but our feeling is that this was very early in her illness, and therefore we're very hopeful that the risk to the patients is equally low.
If that woman was able to contact you, the female physician who went on the plane, and she says she has like a cough or something, but nothing too concrete, what is your plan moving forward?
I think it's way too early in the process to give you a definitive answer to that. It's going to depend on where she is, who she's with, and what the abilities are to return and so on.
Getting back to that low risk, can you expand a little more and explain what goes into determining that? Because you would think 14 people, what if all 14 people went to a shopping mall or hopped onto public transit or had a party? You know what I mean? How do you identify that is still low? 14 seems like a large number.
Yeah, I'm going to let Elizabeth deal this because this is what she does for a living.
So, as I mentioned before about the incubation period, at the earliest, we're looking at about 2 days. So we are just about at the 2-day mark, and we are, Hamilton Public Health and Hamilton Health Sciences is working very diligently to identify those patients, to get in touch with them, and we hope that that will happen very quickly. And so they will be at the very early of the incubation period and self-isolating immediately.
How many of those patients have you already reached? Does that mean there's some that don't do it?
So as we're speaking here today, staff are actively working on these things, both at Hamilton Health Sciences and within Hamilton Public Health in terms of the contacts that are related to the Juravinski. And as well, Halton is acting, with contacts that may be in Halton. And so just to be clear, we don't have definitive numbers and all those sorts of things. Back to your point earlier, Joanna, we wanted to get on with it. We've been on with it since late last night. Our staff have been working all the way through, and we're trying to get the word out here. And so it's very much an active investigation, and so those details will become evident over time.
Does this doctor have a family?
So I'll just note that we're actually at less than 2 minutes to go. To answer your question, she does have a spouse. We are investigating this further around her spouse, and as information is made available, we will let you know.
Just so I'm clear, you said 14 people, these are 14 people with cancer.
Yes.
Does her spouse work somewhere?
So her spouse does work as a healthcare worker as well, so we're investigating further, as I mentioned. I'll take one last question, please.
So the spouse is a physician at St. Joseph's Hospital. We were in touch with St. Joseph's Hospital last night as soon as we knew that to be the case, and they have undertaken their own processes internally around that individual who we are given to understand is not symptomatic at this time.
Sorry, did that person have contact with patients?
Yes.
Was he on the job?
Yes.
What kind of doctor is he?
He's a surgeon.
So can I?
Yeah.
Okay. So that'll be the last question for today. As I mentioned, it is simply a spouse at this point in time. We are still investigating. As I mentioned before, it is still early in our investigation. Thank you very much.